Good morning and welcome to our South Yorkshire Bitesize series. I'm Natalie Wong. I'm Programme Manager for the South Yorkshire Innovation Hub at Health Innovation Yorkshire and Humber. Today's session will be on workforce, which will be covered by a presentation on how to hack the NHS podcast, who will be presented by Cottey and Tano Rebora from Conisbrough Group Practice. These webinars in this series do highlight research and innovation best practice all across our South Yorkshire region and will run weekly from now all the way up until January 2026, with each month focusing on different themes. So as I mentioned before, this month we are focusing on workforce. Next month we have one left, which we're a bit sad about, which is economy. But of course, in line with the 10-year plan, we do want to maintain the energy around innovation as a national priority. Of course, innovation drives progress, it drives problem solving, but it also fosters growth, which really supports our health and care industry. Now, we really hope you feel inspired by our lovely speakers today, gain insight into research and innovation delivery, but can also take away tips to use in your local workplace or system, or if you're thinking about making your own podcast. And without further ado, I will pass you on to the lovely Bex and Tano.
Thank you. Thanks very much.
Yes, good morning, everyone.
Yeah, hi, I'm Bex.
I'm Tano.
And we're the double act that have produced a podcast called How to Hack the NHS, predominantly for our patients, but has turned out to be quite useful for lots of people. So shall we kick off by Tano on why we decided to start this?
Yes, absolutely. Well, it was your brainchild, Bex, so you kick off.
Okay, so having come into primary care about 6.5 years ago, as I learnt about primary care and within the NHS bigger picture, I found out that I was getting lots of questions from family members and friends about how it works or why it doesn't work or why some people can get certain services and other people can't. And whilst I don't have all the answers to everything, many of the answers or the questions that were being asked were the same answers for everybody. So we just thought, you know what, how do we get this out to a wider audience? Because if all our friends and family are asking the same types of questions, then this isn't going to be unique just to that small group of people. It's going to be nationwide. People just don't understand the complexities of general practice or the NHS. So we thought, let's broadcast it.
Yes. And it's so, like you were saying, Bex, it's so often that we're, approached by people and turn around, I can never get to see my doctor, or, and so often having the same conversations about how different practices work, and actually being able to get that information out into the public can help kind of dispel some myths that people might have.
Yeah, there's a lot of misinformation out there, aren't there? And a lot of opinion pieces on social media and things that might not always reflect general practice in general, rather than for one specific place. So we had the idea, I had the idea quite a few years ago, but never really thought about how we could make it actually happen. We realised that we might need a little bit of investment in equipment, and, we were just flying blind, really. And then we were given the opportunity to ask for some money from our ICB because there was funding available for modern general practice. Now, the ask that the ICB had for that was about online consultation tools and cloud telephony and total triage and learning and developing and improving those services within practice. And we were already there. We were already doing it. And so we approached them and said, we're already doing these things. It seems a bit unfair that we don't get to access this pot of funding, but we do have this great idea that we could share, and it would benefit not just our practice, but other people and the wider audience of patients. Would you be prepared to allow us to use that pot of funding for that? And they went away and scratched their heads and ummed and ahed a bit, and then came back and said yes. So we used our little bit of money. We put together the case of how much we would need for a little bit of equipment to get us going, and a little bit, initially a little bit of money to cover our backfill, so that we had some time set aside to do that, and then we got going.
Yeah, so it was a pot of money to get things started, wasn't it?
It was, yeah, like seed money. So we bought a couple of laptops.
Yeah.
And a couple of microphones, very posh microphones.
Yes. They make it sound a lot better than we actually are, so that's good. We also
sound much more Radio 4 than we do on this today.
We also have he's not really a silent partner because he's very vocal about the feedback he gives us. But our colleague David Coleman, who is really the one that makes us sound very professional.
He does.
And is very driven by sound quality. So yeah, the three of us get everything working right.
Yes.
So yeah, it's that, you know, the bits and pieces of equipment. I mean, I'm pretty much a technophobe, so if I can manage it, anyone can pretty much do it. But yeah.
And we have little crib notes, don't we, for our setup every time?
Yes, which also include as kind of photographs on our screens of where little
cables go,
because we're really quite inept. But somehow it comes out, so that's all right.
And David does a great job of editing and making sure we stick to content, because like now the two of us just sit and chatter about
ramble
things. So he has to take out the nonsense and make it sound coherent. So that's how we started and why we started. We set it up in my spare bedroom at home, and I even made I had an old table that we were going to set up all our equipment on and fasten the microphones to and things. And I even covered it in a piece of felt so that it was more soundproof. I was like desperately trying to make things sound a little softer and more rounded. So we really committed, didn't we? Yeah. So do you want to tell them about how much time we actually have to invest? And
so that one of the wonderful challenges working in primary care is that we both work full time. The podcast time, or the time we spend on the podcast, is all done in our free time. And it's really important. We say that on the podcast, largely because sometimes people might feel, oh, if you're doing this, what are you not doing? And as a medic, people are not happy that I'm not seeing patients. So yeah, we do this in our own time. In terms of prep, we kind of get together. I mean, we work together, so that's really helpful. So it is a case of popping in and having a 5-minute conversation, prepping what kind of topic we're going to talk about at the next podcast, and then we will kind of go in our different directions and work on what we want to plan to say, and then we get together and put something together. So usually it's a Saturday morning, getting together and doing that. What then happens is whatever we've recorded, we give to, as I said, David Coleman, our colleague, who kind of edits it to make it sound more professional than we are, and then we deliver that out. So that process can take quite some time, no matter, there's always a bottleneck in these processes, aren't there? And it's kind of the editing process can take a bit of time. So over time we've done things slightly differently. We completed our first season, and actually looked at our kind of ratings and listening time, and we saw some really interesting patterns. And what we've now looked at going forward is making things a lot shorter, and doing things by video, largely because that's where most of the audience is heading. So we're kind of adapting as we're going along.
So initially the long format we had was to talk about something within the NHS that patients and friends and family ask about the processes, and then we also had a segment on the end that covered a very common medical complaint or illness or whatever, and we realized that people were sticking with one bit or the other bit, and so we just said, okay, we need to separate these out and make them shorter. The long format podcast is great for people who are on a commute, but when you actually just want a quick answer to, could you just give me a brief overview as to why this happens or why that happens or how this works? And we've just realized that people just want something really quick and instant. So social media world now brings our attention spans quite low.
And it was interesting, so we've done some kind of trial videos that were put onto YouTube, and we've had one that's almost at 1,000 views, which was answering a question about what a PA was, and it was one of those kind of telling moments. That was a 3-minute video, but that was something that people really wanted an answer to. So that's the kind of direction we're heading in.
Yeah.
And so still doing some podcasts, but actually doing some short things as well.
Yeah. So yeah, and then in terms of the actual things that we choose to talk about or choose to address, it's often guided by feedback from, again, those friends and family around us, or something that you might see frequently coming up on our triage list. And we think, oh, people keep asking about this, and we have to keep giving them the same answers, or saying, you know, why this might not be the most appropriate course of action or care, and explain things to people in a nice, short, easy format. And then we also take suggestions. So when we did a Q&A long format, didn't we? And we got questions and answers, questions from people that we then tried to answer, so that we keep it relevant. We, you know, what we might think is interesting and useful from a certain perspective, we can use because we're providing a service within practice, and we know we can see certain things that people might not understand. But it's best if it comes from the audience always. So, and we'll give you the opportunity to let us know what you think, and if there's anything that you would like us to cover in them, because we're going to talk a bit later about how you can benefit from this as well.
It was really interesting recently. We've had some new staff join our practice, and before they, well, as they were joining our practice, they've been starting to listen to the podcast, which was really, really lovely and supportive. And one of them turned around to us and said, "It seems like you're aiming towards a certain demographic, and I feel that these areas need to be kind of addressed. Would you take some suggestions?" Of course, absolutely. So our next our next homework is going through those, really. But it's really interesting knowing that, or understanding that there are people out there that feel either that we haven't addressed certain things, and making sure that we address them now.
Yeah, and it helps us give a nice wide audience as well, doesn't it? Because, you know, if we come across as aiming it at a certain demographic, we're not intentionally doing that. It would be nice for us to be able to hit a wider audience. And another example that we had, and that was administrative staff learning and understanding about the NHS. We also are a training practice, and we have registrars that come to us, and they may be, as part of their training, it might be the first time they've entered the NHS arena and understand general practice here in the UK. So we encourage them to listen to it as well, and they've often fed back and said it's helped them understand the wider world of general practice and put things into context for them.
Yeah, absolutely. So, you know, people understand, obviously, you know, we're, you know, as registrars, you know, I'm going to work for the NHS, but they kind of struggle to place where primary care comes into that. So being able to answer some of those questions is helpful.
Yeah, so it's another good way in which you can advertise it and send it out to people and make suggestions as to who will benefit from it. It isn't just patients. So yeah, so the benefits and impacts, I think, how else have we used the podcast? We've used shorts to send out to patients. So we've had patients might send perhaps a complaint or an inquiry about practice, about how they're frustrated by something or something doesn't work. And it may be something that's not necessarily in our control. As we know, in primary care, we get contacted about every part of the NHS. And so sometimes it's helpful for us to just send out rather than a long formal, you know, letter of response, we'd explain to them, you know, we understand your frustration. This is a scenario we're in, and this is why it's different in different places. And we might send them the link and say, you might be interested in listening to this. It's free. You can download it or listen to it on any platform. And you might find it interesting. And we hope it helps answer your questions or help you understand why it's frustrating for us too.
I mean, the NHS is such a big community, and people, you know, I think I read some statistics somewhere that said that, you know, each person in the UK will know at least one person, that 1 in 6 will work as the NHS. So it's crazy numbers. But no one actually knows what that means. So sometimes they'll say, I work in the NHS, but what part and how does that work and how does it all fix together? It's really quite challenging jigsaw puzzle.
Really complex thing to try and explain and understand. And that's why we try and stick to our lane of primary care
Yeah,
and general
we know
practice.
that bit.
Yeah, we can't answer all the questions about every other department in secondary care or community services or anything like that. So that's why we try and do it from the gateway of general practice. We've also had some guest speakers on. We were
Yes.
really excited about that because, you know, when you do these things, you never know really until you release who your audience is, who's going to be interested in what, and you know what kind of response you get. And some are bigger hits, like Tano said previously, some are bigger hits than others. And so we thought, oh, do you think we can convince some people to come on and be guests with us and talk about their specialty area?
And that was really interesting. And hearing their background was really interesting as well.
Yeah. So there's one on there about technology and the use of technology and in primary care. And we had on somebody from the ICB, local ICB, talking about the general policy and so on, and some of the innovative things that are going on. And we also had the clinical director from Accurix, Satya, joined us because they're obviously a big part of technological use, not the only one, but she came on and talked about their vision and how it's helped and how it's developed and so on. So it was a good one. I thought I enjoyed that.
Yeah, and I think also, you know, there's a lot of questions about online consultation models at the moment, and a lot of again, myth busting. A lot of people have a lot of questions about it, and some of the kind of fears about kind of medical data, how that might be kind of would that be accessible by other people, and just giving reassurance that no, it's still a very secure system. You know, you can use that freely.
There is a lot of anxiety around the use of technologies, and I think it's becoming as well because it's quite fast paced, and there's quite a lot of pressure for practices to be constantly keeping on top of it and understanding it. And then actually, none of us are specialists in technology. You know, we don't come from a tech industry background, far from tech industry backgrounds, but it's just that, you know, making patients understand and aware that we are being very careful in how we use our choices and we do our due diligence.
Yeah, I think one of the other things that's quite interesting is, you know, we've been doing it for a little while now, and finding out that some of the early kind of episodes that we did, there are parts of that even just 6 months, 12 months later are not obsolete, but have changed.
Yes.
And we are having to almost go, you know, we talked about this before, well, it's actually a little bit different now, and that's really interesting. It just gives you an idea of how quickly things change, you know, in all areas of our lives, but particularly in primary care.
Even within one season, we had to kind of backtrack and update and say we talked about this in episode 2 or whatever, and we just need to give you a bit of an update again, because, you know, people read things in the news and say, well, how does that impact? And we try to respond. And circling back to talking about the fact that we are both full time and we have to fit this in spaces. We're not by any means like prolific producers of content. We're not influencers. We do this as and when we feel there's a topic that really is burning and people really need to know about. And because we're fitting it in around everything else, it's not like guaranteed every week or every month or anything. We just kind of go, okay, we tried to get them out monthly when we first started, and that worked. And then we went, okay, we've covered the main body of the main questions. Now we can be a little bit more reactive. So we talked about things that might have come up in the media for patients, or they might have questions about. And then we keep adapting and looking at our statistics and figures and listening figures and that kind of thing, and look at how we can keep tailoring it and keep making it relevant and useful.
Yeah, and as Bex was saying, because we both work full time, there were other things that impacted our availability. So, for example, there was quite a lot of staff sickness, and you know, going into the kind of summer months, you know, we had staff sickness impacting on vacations. So there was this a period of time where we just couldn't make it happen because we were kind of just putting all of our energies into the practice, which is our primary kind of drive. So there has been a little bit of a stop-start kind of rodeo in the past.
And because of that, we make no money off this.
No, none.
We're not ready for retirement because we've just become so huge. No, it's a little niche, little niche podcast. But having said that, we do want to keep it relevant. And I would say to anybody listening to this today, or listening back to the recording, is if there is something you think that would be useful for us to discuss and patients should be more aware of, do drop us a line. We've got an email address, which is howtohackthenhs@gmail.com. So it's nice and easy to remember. And if you want to listen to the podcast, you can get it on any of the major podcast platforms. But yeah, we do need that feedback and those suggestions. And if it's a short one or a long format or whatever, we'll keep mixing it up and producing whatever you think is useful. And in terms of those people today, if you think it is of use and you want to share it, there is no cost to you. You can share links, you can text them to people, you can put it on your social media. We don't mind. We're not precious. We don't care about, royalties or whatever exists. It's just there, it's just free. And if it helps you in your role as much as it does with us, and helps us kind of make sense of things, then feel free to
use it.
Yeah, to use it.
Yeah. One of the other places that have benefited from using it are medical students. So these are entering this whole new world and stage in their lives, and just understanding where different parts of the NHS fit and work can be really, really helpful. So feel free.
Yeah.
Thank you both. I'll bring myself back on. We are just going to run a few more polls throughout the session just before we jump onto Q&A, but it'll just give everyone a couple of seconds just to think about what they might want to ask. But for me, that was incredibly interesting. And I feel like that was in true podcast fashion, the way you just described everything there, which is really nice to see. Really fresh. I quite enjoyed it. I hope everyone else enjoyed it. So I guess just starting off from myself with a question. So I guess over the past few months, there's been a lot in the news around misconception, especially around kind of medicine or, how to speak to a clinician or even taking paracetamol when pregnant, as we may all have seen. I guess, how do you tackle things like that you see in the news, which are so prevalent and so relevant in this space? And do you see your platform as a bit of a space, I guess, to give correct information to patients and staff?
Yeah, really good question. I think we're currently in a world where people are getting lots of different bits of information from lots of different sources. And I think one of the main issues we all have is how verified are those sources, and how reliable that information is, in spite of who may have said it. Because we have people who are in positions of power that might say things that are not necessarily helpful. So I think partly we see the impact of that in our day-to-day work. So we have an online consultation platform. We use AccuRx at work. And what will happen is whenever something like this comes through, we will see a lot of activity through that. People asking lots of the same questions everyone is asking. And part of that is can we find a way in which we can respond to that, and can that be helpful to get out there so people have got that information? And hopefully having kind of people who've worked in the NHS for some time kind of adds to our credibility in terms of, this is what the evidence currently says to us, and this is why we're saying it to you.
And we do try and keep like the medical side of it very factual, evidence-based, scientific-based. This is what the research says, at the same time as adding our own opinions, and we are human. Excuse me. And so we just kind of add in those bits to make it less dry and less and more relatable. When we talk about, for example, we did weight loss and we were like, this is what textbook says, this is what works, and you're like, but we've both struggled with weight loss and we find it really hard, and we're human and these are our struggles. It's kind of, it's making sure that there's the evidence, this is what we know is good, but we know the real life is hard, and we know what other people might be saying and influencing, and it's confusing, and we kind of try and acknowledge that, don't we?
I think that's brilliant. And I think the whole relatability to yourselves as well, I think puts a very human element to you running a podcast. And I think actually you would hope that would drive people to listen more intently, or to feel like you are people they can trust because you are putting that personal touch on it. So it's definitely a brilliant way of doing it. I do have a question from Natalie. Thank you for your question, Natalie. Can you say a bit more about the equipment and how you decided what to get? What about the editing and what software is required? Oh, it's a podcast question.
Yeah, tech question to the two non-tech people, but we'll do our best. So we bought two laptops. Just we bought Macs because we know their capability in terms of producing video and social media content tends to have a better reputation. We were guided very much by David on this. The microphones we have are Rode ones. And we bought them with a stand so that we didn't have to be holding them and thinking about how far they are away from our faces and that kind of thing, although we do get coaching from David on that as well. Were you turning your head too much where you're talking and things like that?
Look directly forward.
Yes. And then we had to put little guards on the front so that it softened the hard consonants when we were talking, things like that. And then the software we've been recording when it's a video one, we've been using Zoom, and we also used the other one we used.
Well, did we not use Teams for one as well?
We used Teams for one, yes, we did. Yeah, when we had guests on, we used Teams.
Right.
So yeah, when it has video, then we just use one of these
well-known
platforms, and you can just record it and then add it to the editing suite. And I think the editing suite is, oh no, can't remember what it's called.
We can always find out and let you know.
We can let you know. This is why we do the talking and not the editing.
I'll cut that bit out.
Yeah, edit that bit.
Start that again. I'll edit that part out.
Natalie, you're very kind. We will get an answer to you. I do apologise.
Yeah, thanks, Natalie.
Yeah, Natalie, if you can bob your email in the chat, it means that Bex and Tano can pick that up as well.
Absolutely.
I mean, alternatively, we can share that with everyone as well if everyone's interested. But thank you for that question. I guess I've got another question, me being cheeky, throwing in all my questions again. What would you say has been kind of the main feedback you've had from listeners, and who are your kind of main audiences at the moment?
So very interesting. One of the platforms that we've got the podcast on is Spotify, and on there you can see lots of comments, which is lovely. And it was interesting seeing that a lot of those comments came from peers who work in primary care, and it was finding out their role in the NHS. So, for example, we had a lovely pharmacist who gave us some really lovely feedback, going, "It's really nice to understand the kind of my position within the organization and in primary care itself." So we're getting kind of feedback not just from the public, but also people who work within our kind of sphere of profession.
Yeah, because like we've said before, even if your role is outside of primary care, but you are touched by it or influenced by it, or are referred from it, then it's nice to know how you fit into that bigger picture. And we did a big one about all the additional roles from PCNs, and we had lots of people going, "Oh, it was so nice that you mentioned our specific role." We went through as many as we could, but people just going, we felt acknowledged. People on the outside of this world that we live in often don't know that we even exist, or what our role involves, or why we're important to it, and actually it gave them some kind of verification.
And members of the public will get an appointment, and they sometimes feel that they're just so desperate for an appointment that it doesn't really matter who it's with, as long as someone is seeing them, and being able to explain, well, no, the reason you're seeing this particular clinician is because they've got this background, and that's really helpful because it reassures patients that they are seeing the right person at the right time, which is exactly what we want.
Exactly what we wanted. Yeah, exactly. And that's kind of our strapline, isn't it?
Yeah.
Is to say, get the care you need when you need it, by understanding, processes and systems and how all these things operate. Because we just think the more educated you are about these things, the more you understand it, the easier it is to navigate. And you really do have to navigate.
I think you both make such a valid point on that. And I think especially around kind of the whole incorporating other areas and not just PCNs, I think is such an important point, because I think often within healthcare, we of course always discuss what we do as working as a grand system, but actually if we look at the nitty gritty, often it is the case that we are working in silo at times. And I think that acknowledgement of other people, I guess, brings harmony to the whole system working. And I envisage that actually as time goes on, when we move into things like neighbourhood health hubs and neighbourhood working, there'll be so many other roles which may be brought into the NHS who may just want to see where they fit in, or may see kind of how they can work with yourselves. So I can only hope that at that point the podcast will blow up, not in a bad way, in a good way, from a viewer's perspective, and people will reach out and kind of, I guess, give you themes to even look at that might support them kind of going forward. Because I think, I mean, we all know changes to come, don't we? And we know, you know, we don't necessarily always know what that change looks like. I mean, this is just me picking your brains here, but, you know, with the whole kind of neighbourhood health model that's coming through, what do you envisage the challenges will be like for that?
Yeah, well, I think the challenges are always about how we communicate the changes to our patients. It's really difficult now to find the right way to communicate a message to patients. Sometimes we send text messages, sometimes we have to send a letter, sometimes people prefer to go to a meeting and hear about it within a group. Some people just want to listen to a podcast or scroll past it in a few seconds on social media. And we have to, in a way, think about covering all these bases so that people actually understand what the changes are and how it impacts them and how they can benefit from it.
And like you're saying, it's the relevance, isn't it? So I know that I've heard that there's some changes coming. What does that mean to me?
Yes.
So, you know, the whole idea of, you know, online consultation, we had lots of people kind of going, oh my God, what does that mean? I'm just going to see people virtually now. I'm not going to come into the surgery. And I was like, no, that's far from what it means. But giving that reassurance, being able to explain that, I think is really important, because you've got a lot of people worried. They're worried about their health, they're worried about their family's health, their kids' health. So being able to turn around and say, well, no, listen, this is all it means.
That's really helpful, thank you. I have seen that Natalie's posted in the chat around posting a link to the podcast, which I know you won't have a specific link for because I know you're on kind of all major podcast platforms, but just for the sake of attendees or those who are listening afterwards today, do you just want to go through some of the kind of major platforms that you are on already? I know you mentioned Spotify earlier.
Yeah, Amazon, Spotify, Apple podcasts. I think Google have got rid of theirs now, haven't they?
I think so.
It started there, but then I think the platform changed. So it's those. So whether you pay for a service, you know, like Spotify that has podcasts on, or whether you get them free from, you know, your provider.
Even if you searched on a website, you would find it.
Yes. And it's howtohackthenhs.com, but it doesn't have www in front. So don't put that in, just type in your search bar with the HTTPS thing, just type in howtohackthenhs.com and you should find it. And at the end, we'll put up a little slide that has our logo on, so you know what it looks like and you know it's us. Yeah, not some strange tech hacking company.
Which would be so ironic.
It would. It really would. Yes.
Yeah, how to hack the NHS podcast.
Yeah.
Brilliant, thank you both. I guess final question. I'm just having a look through the chat again to see if I've missed anything. Whilst I'm having a scroll through, I guess something for you guys to think about. If there are people here today who are thinking, well, actually, I've got a lot to say and there's things that I want to spread, what would you recommend to them when it comes to starting a podcast? Where can they begin?
So I think we were really lucky in that we got this packet of funding to start this, but I don't think you actually need that. No. You might, I think it's just as easy to do it with your phone or use Teams on your computer, home laptop, home, you know, PC, whatever it is, and record it that way. And I think we use free software or very, very cheap software to do the editing, but things like GarageBand, if you're a Mac user, that can do all your editing, you know, and it's very, very clever and you can get it to a great degree. And in terms of microphones, you can even buy really cheap clip-on ones like you see people using on social media clips, as long as they have the little fluffy cover so that you don't hear every breath or every gust of wind or whatever else going on. And it's just as easy as that. Get your voice out there and tell people what you care about. I think I think what people just say to us when they do listen is, we get how passionate you are about this. We get your enthusiasm.
We think we're really interesting. So, no. But we think the topics are interesting.
Yeah.
One of the nice things is that I think everyone can relate to the NHS in whatever kind of sphere they are, or place they are in their lives. And I think everyone can relate to medical problems, because
we all have them.
We all have them.
Yeah.
So that's what drives us, really.
Yeah.
Thank you both. That's really, really helpful. I'll just close the session. So thank you everyone for attending. A massive thank you, Bex and Tano, for your support today. It was so interesting to hear about, I guess, how you turned this into a real life thing, which is brilliant to hear. All of our bite-sized webinars, as I mentioned earlier, are recorded today and will be uploaded onto our South Yorkshire Innovation Hub website, just for you to share with colleagues and if you want to rewatch any of them back. As I mentioned earlier as well, this webinar is part of a whole bite-sized series, and we will have other sessions further this month and also in January as well. So if you want to book onto any sessions, you can also follow the South Yorkshire Innovation Hub website. But a massive thank you again to everyone. We'll see you all soon, hopefully. Take care. Thank you. Bye.
Thank you.
Thanks. Bye.
Bye.